The typical path for anyone seeking out behavioral health services sometimes starts in primary care, sometimes it just starts with an individual or a family member wanting to get mental health services for a family member, a child, a loved one. And oftentimes it's picking up the phone and making phone calls to counseling agencies in the area and trying to figure out who might my insurance cover, who has an opening, who could see my loved one, my child, and really kind of trial by error for a lot of people trying to access mental health services.
It was hectic, and it was kind of like being a firefighter. It was a really good way to put it, just going from fire to fire and just trying to deal with those issues as they came along and being the one person who could do that.
We would get calls from schools wanting us to help out with different students that needed mental health services, but there were so many barriers that they weren't getting that. A lot of the transportation issues, or parents couldn't get them to appointments, so they were kind of falling through the cracks and not getting those services.
I was the lead person within our school district that facilitated all the meetings, and so we created a district level team with our school psychs, our counselors, our administrators, principals, and everyone to be able to put together a comprehensive plan so we're all on board.
We've always been, as therapists, involved in collaborating with schools, speaking with school counselors, teachers, principals, working with the family and school in combination to making sure a child can be successful in the classroom, but actually doing what we've done here at Bellin and opening a behavioral health clinic in a school is a little bit newer.
I wish my teacher knew that I was lonely.
I wish my teacher knew I'm nervous to tell her something.
I wish my teacher knew when I get corrections, I get frustrated.
I wish my teacher knew I have a hard time thinking because my grandma has cancer.
I wish my teacher knew
I don't have someone to call a best friend. I think this is a perfect example of the stress that our students go through day to day of trying to navigate the social context of school, trying to fit in, trying to balance life in a school setting. There's definitely a stigma about depression and counseling in general, but I think proximity to those services definitely makes a difference. And when you bring those services closer to home, people are more comfortable with accessing those services and talking about those types of things. Once that's been established in their school system, being able to know that that's there and approach their school counselors and ask for those services.
It's less complicated for our parents, so I think I see parents taking part in the program that maybe wouldn't have taken their children to outside counseling.
We have provided over 3,700 visits in the schools, and we've helped over 412 children in the schools. So it really is a labor of love and a grassroots effort to reach as many kids as we can. We couldn't do it without the partners that we have in the schools. We couldn't do it without the support that we have from senior leadership across the Bellin organization.
In a perfect world, every school would have a mental health therapist. It's a need that so many people have been talking about. And I think the more that we provide those services, hopefully we're going to see behaviors changing and we're going to see truancy rates going down. We're going to see students succeeding and getting that preventative stuff that in early, so we're not seeing it later in life where they can have the coping skills to deal with it sooner. And hopefully start reducing the stigma of mental health.
The Bellin Foundation has recognized school-based mental health services and youth mental health first aid as a real important issue to address, is that we're hoping that we can raise funds to help promote and continue to promote school-based services and help families be able to afford the services that kids need.